Hello everybody, Dr. Alex Vasquez here again with the second video of today. And right now I'm going to focus obviously on this article, Implementing Effective Healthcare Reviews. This is from the Agency for Healthcare Research and Quality in the United States. This was published by the American Academy of Family Physicians in their journal, American Family Physician. So this is a really good journal for kind of taking the pulse of family practice medicine. I'm not saying, it's obviously not a specialty journal, it's just a practice journal. But it provides the exemplary status, so to speak, of the current practice of medicine. So this is how family practice, primary care physicians practice, almost by definition and almost by obligation. So in order to maintain, board certification in family medicine, pretty much the doctors follow these guidelines and have to follow these guidelines for the most part. I'm not saying doctors have a little bit of flexibility, but not a lot of flexibility, especially if they're practicing in a hospital or public clinic or something like that. Anyway, let's look at this. Non-opioid Pharmacologic, so they're only going to talk about drugs here. Treatments for chronic pain. So let's just look at the title of this before I get into it. So this was relatively recently published. I think this was either 2021. So this is still obviously current. And I don't have a lot to say about it, so I expect this video review to be pretty short. So let me see, what do I want to say about it? It's an efficient short review, basically documenting how family medicine doctors are supposed to implement these guidelines, but also the shocking lack of efficacy of these treatments. So this one document basically demonstrates that most of what family medicine doctors are going to do for chronic pain doesn't work. So you don't have to be a conspiracy theorist to say, oh, well, medicine sucks and medicine doesn't really work and they don't know what they're doing. I mean, this document proves those facts. It proves that they have no understanding of pathophysiology of chronic pain, and they're just basically pulling whatever drug off the shelf that's convenient, basically. So again, non-opioid drugs. Now, yeah, so they're basically going to limit the conversation to prescription drugs that aren't opioids, okay? Anyway, the topics covered here are chronic neuropathic pain, fibromyalgia, inflammatory arthritis, specifically ankylosing spondylitis and rheumatoid arthritis, osteoarthritis also, low back pain, and I guess as a treatment document, this article is horrible. If we were to say, well, they weren't trying to cover everything, they're only trying to cover the drugs that are not opioids. It's a competent review, obviously, otherwise it wouldn't have been published by the American Academy of Family Physicians. But again, it just shows that they don't know really what they're doing. And they're just reaching for whatever's convenient. So a lot of times what I see, and the way that I interpret what I see in medicine, is they adapt the practice of medicine. The practice of medicine becomes basically whatever is the convenient drug to prescribe for whatever the condition is. It's not based on understanding the condition and then doing what's appropriate for the condition. It's based on looking at what drugs are available and then saying, well, I guess we'll do that, but not really making sense of it. Oops, sorry. I just lost the page I was working on. There we go. So I'm not exactly sure how to review this. I'll just go through some of the topics, and I'll post the article. The article is available for free, so I'll post it on the website obviously, as well. Treatments they discuss here are anticonvulsants, antidepressants, NSAIDs, non-steroidal anti-inflammatory drugs, memantine, which is an anti-glutaminergic drug. They use antidepressants here, either SSRIs or SNRIs, which again shows they have no idea what they're doing. I mean, why would they use these drugs in these ways for these conditions? It's just ridiculous. It just sucks. So, this is the carrot on the end of the stick. After busting ass, let's say, for 4 years in undergraduate school, going through the absolute ringer in medical school for 4 years, and then going through family practice residency, working, 120 hours per week for 3 years to become a family medicine doctor. This is the reward that you get, is to practice cookie cutter fast food medicine that ultimately doesn't really work. So let me see if I want to say anything else about this. Some definitions here. They quote the CDC. CDC is irrelevant. So is this other organization. And then they talk about the effects of these treatments in clinical trials. And you'll see that most of them have only 1 or 2 dots, which means they're either minimally effective or moderately effective. The only treatment that gets 3 dots was for short-term pain relief in osteoarthritis using a drug from the antidepressant class. That's the best they can do? I mean, that's just horrible. Look at most of the results here. Most of the results, let me see if I can highlight that. I might not be able to highlight it using, I guess I can, but it's just kind of slow. Look at the long-term pain relief and inflammatory arthritis. Look at most of the, excuse me, most of the evidence provides no support for these treatments. And these are multi-million-dollar industries in the United States, and they have no supporting evidence for long-term use. And they're prescribed long-term. Neuropathic pain. They talk about capsaicin and cannabis. Usually the way they do those trials is they design the trials to fail, so that's why they show no evidence. Moderate evidence with memantine and fibromyalgia. Ridiculous. Not horribly ridiculous if you understand the mechanism of action in that disease, but it's obviously not addressing it's not addressing either the primary or the secondary events in fibromyalgia. So if it works at all, it's never going to cure the disease. Again, if we look at this page, short-term, very small benefit to the vast majority of drugs. These are mostly focusing on NSAIDs, even though this table isn't very well described. But look at the evidence. Let me see if I can highlight this. This is probably worth highlighting, even though this program is kind of slow on the highlighting. No evidence. And then what do I have to do? Let me see if I can do this faster. No. So I have to do this every time. No. So I'm just going to highlight the ones that are no or very small evidence of benefit. Let me do it that way. So let me go back.